starting. Okay. So hello, everybody, and welcome back to another virtual open house session. I'm here with our School of Nursing, and I have some very interesting folks with us that are going to tell us a little bit about admission into the program, provide us with an overview of the program, some really cool features of the School of Nursing. But before we get into that, I just wanted to introduce some of the folks that we have here. So Patty, if you wanted to give us a quick introduction of yourself, that would be wonderful.
Thank you. So my name is Patty Tracy, and I'm the Collaborative Program Coordinator here at the School of Nursing. And I also clinically instruct the students who do a placement in their second year internationally.
So Kathleen, if you wanted to introduce yourself.
Sure. My name is Kathleen Crook. I'm the academic coordinator in the Trent School of Nursing. So one great thing about my job is that I get to meet with current students and sort of help them as they move through the program and make sure they're checking off all the boxes for their degrees.
Awesome. And Hugo.
Hi, I'm Hugo Lehman. I'm the Dean for the Trent Fleming School of Nursing. It's a pleasure to be here and to be able to interact with you today.
Okay, awesome. So that's the wonderful staff that's going to help us today. And Kathleen, I'll invite you to share your screen here if you can, to give us a little bit of a presentation about the School of Nursing.
All right, there we are. Okay, so yes, we are the Trent Fleming School of Nursing, and the baccalaureate program that we offer is the Bachelor of Science in Nursing, or the BSCN program. Our school is comprised of a diverse community of scholars and educators, and within the program, we have 5 areas of foci, which include mental health, aging, rural health, Indigenous communities, women's health, and gender. And what that really means is that our program, like any other Bachelor's of Science in Nursing in Ontario, in Canada, is accredited to give you a Bachelor's of Science in Nursing and become a registered nurse. But within that program, our faculty have these areas that are, sorry, got a little lost there. We have these areas that are in courses that we offer, as well as into our faculty areas of research and some placement opportunities as well. Our program has 3 entry points and 1 curriculum. So regardless of if a student is in the collaborative program, which is a 4-year Bachelor's of Science in Nursing, or a compressed program, which has been condensed into 28 months, the curriculum that they're completing is the same. It's just done in a different way. So it's offered through a different set of courses or a different timeline. We also offer a practical nursing 2 Bachelor's of Science in Nursing program with George Brown College in Toronto, which is a unique partnership for those who have a practical nursing background. So some of the highlights of why someone might choose Trent for nursing is that we actually begin clinical practice in first year. We think it's really important that students have the opportunity to get that hands-on experience while they're learning the theory and start building those skills right from day 1. It's also a really great opportunity for students to test the waters and see if this profession is going to be a good fit for them. We offer a lot of experiential learning opportunities. Nursing is a very hands-on profession, so students have the ability to practice their skills in our simulation hub. They work in small groups and attend clinical in small groups, which allows for a lot of one-on-one or one-on-2 training with our faculty and our clinical instructors. We also offer international, rural, and remote placements where they get that in the field experience. We have faculty with many areas of expertise that they bring into the theory and the clinical environments. And finally, we also have research and thesis opportunities at the undergraduate level, which is really important for those who want to be on the forefront of research in health. And our nurses in Canada provide a lot of really valuable research. So it's a great opportunity for students to engage in that research early on. Just a brief overview of what the collaborative program looks like. As I mentioned, it is a 4-year program. So students move through the program with their nursing theory courses. They'll take electives as well. And this just highlights the different areas of clinical practice that they'll be doing These are sort of the main focuses within the 4 years of the program. In year one, students do one clinical placement starting in the winter term, and that is in a long-term care facility. In year two, we focus on families and communities. So they're doing 2 clinical placements, and they do approximately 256 hours of clinical placement and simulation. In year 3, we move to acute illness and chronic disease prevention. These are hospital settings, and students are doing roughly 320 hours of placement and sim. And in the first 3 years of the program, students are going to clinical in small groups of about 8 students. Your labs will also be about 8 students. So when we say we have small class sizes and that opportunity to really connect in the program, we really do mean it. In year 4, students have 2 opportunities for what we call independent practice. So at that point, you're paired with an RN and you're working with them one-on-one in the clinical environment. Each of those placements is 300 hours. So students actually acquire 600 hours of clinical placement in their final year of the program. The collaborative program is primarily for those entering from secondary school. So folks who haven't attended post-secondary and are coming right out of high school. These admission requirements are from our website, and they are for domestic students. So they're specifically speaking to Ontario students. However, this is just to provide a general overview of what's required. They're looking for English, math, chemistry, and biology. And so we need at least 70% in each of those as the prerequisites. Depending on where you're coming from, there may be a different calculation included for how they're going to calculate your GPA. But typically we're looking for 75%. If for the Ontario equivalent, it's those 4 prerequisites and then your next 2 highest university level courses or academic level courses that they would be looking at. So 75% is the minimum for those coming directly from high school. And this is a competitive program. So because we have a set number of seats for the program, it is competitive. So meeting that minimum requirement does not guarantee admission. Typically, we'll start at the higher GPAs and work towards our cutoff, so it may vary from year to year depending on the applicant pool. The compressed program that we offer is a 28-month program, and it's really designed for those who have a background in post-secondary. So if you have taken at least 2 years of undergraduate studies or completed a bachelor's degree and have decided to maybe change careers, the 28-month program is really designed for that. What we've done is some of the elective and support course requirements are taken out. Students receive those as transfer credits when they apply, and they're able to complete the program in 28 months. This program does include summer courses, so that's an important feature when you're choosing your program. If you are looking for something that's a little more condensed, this might be the option for you, but students do go through the summer in order to complete all of the clinical placements in that condensed time frame. The curriculum is the same, it's just delivered a little bit differently because students are coming in with transfer credits and some of the electives already met. Admissions for compressed, similarly, we're looking for the English, math, chemistry, and biology, but they're also looking for credits that have been completed through undergraduate study or possibly diplomas, kind of depends. We need at least 2 full credits, which is 4 semester-long courses at the 1,000 level or the first year level. We also need 1 full credit or 2 semester courses at the second year level, and then 1 full credit of introductory psychology. In lieu of that, they may also take a third year level elective. So those are the additional requirements for coming into compressed. As I mentioned, it's not a direct entry from secondary. It does require some post-secondary to have been completed. The average for this is a little bit less. It's a minimum of 70%, but that's calculated on undergraduate studies. So it's a different pool of applicants. And we're looking at the last 2 years of an undergraduate degree typically. Again, it is a competitive program. So the minimum GPA is not necessarily what one needs. It might be higher depending on the applicant pool of that year. A note for international applicants, there is some great information on the website, and we do encourage you to consult trentu.ca/international to review some of those equivalencies when we're looking at the prerequisites for the program. For those applying from post-secondary, if you've done a degree or a diploma, a WES evaluation is highly recommended. The reason for that is the timeline of assessment. So having a WES evaluation, because we do have a limited number of seats, that evaluation having already been converted, it does just speed up the application process. Whereas sometimes if we're receiving specific transcripts, if there's information missing, it can become a bit of a back and forth, and that might delay admission to the program. So it's recommended, but it isn't a firm requirement. The application deadlines for the collaborative program from secondary school are January 12th of 2024. And the compressed program for post-secondary applicants, the deadline is February 16th of 2024. Applicants who have previously completed medical training programs will be considered on a case-by-case basis, and internationally educated nurses, or IENs, are encouraged to apply to the Ontario Internationally Educated Nurse Course Consortium, which is a lot of words. The OIENCC essentially will evaluate what your nursing background is to identify if there are particular areas that you can just take individual courses or complete clinical in order to become accredited with the College of Nurses of Ontario. So our program is really designed for those who have not been nurses before, the program that we offer in the School of Nursing, but there are some great resources for those who have a nursing background and are looking to come to Canada. We do work with them to help find students placements, but you would be applying through them directly in order to do that. So tuition for this past academic year for the nursing program was this number you see here, and that can vary from year to year. The website is a really great resource, and I know during the different sessions today, you can also access information about scholarship and how to make it more affordable if you are looking to study in Canada. And finally, some contact information. You have some specific questions about nursing admissions, nursing admissions at trentu.ca. Zachary Davidson is our enrollment advisor for the nursing program and is happy to help and support students as they apply. We also, if you do just have questions about the program, how it rolls out, accreditation, anything like that, nursing at trentu.ca is a great place to start, and we will find the best person to answer your question. And that's it from me.
Awesome. Thank you so much for that, for all of that information. Really, it was really comprehensive and relevant for the international students. One of the things that I just wanted to briefly talk about, because we talk about this quite a bit on the road, that because Trent University is located in Ontario, most of the students that apply to Trent are graduates from our secondary school diploma program, so the OSSD. And when we talk to international students, sometimes they'll have the OSSD because they'll have attended an Ontario school international, but sometimes we'll speak to students who graduate from the IB program, AP, the UK curriculum, the Indian curriculum, the West African curriculum. So we talk to a broad range of students. And so what I always strongly encourage students to do is apply, because we take all of that information from your current institution. If you're from secondary school, if you've already graduated a university, we'll take that information and we'll convert it into our system. We don't do like pre-assessment, so it's hard for us to look at a transcript and say, oh yes, you'll be admitted, or no, you won't be admitted. You'd have to go through the proper admissions channel. So we always strongly encourage students to apply as early and as comprehensively as possible, because it gives them an opportunity to apply for scholarships and hear back from us. And if we're waiting for documents, then it just gives us a little bit more time to make that well-rounded assessment. So I just want that a quick note, but we'll have a few questions here. And the first one's going to be about faculty and who teaches the program. So I'll invite anybody on the call right now. If you could share a little bit about the faculty that actually teach the courses in the program and supervise, that would be great for the students to hear.
Sure. So I can start, maybe Hugo, and then you can jump in. But we have amazing, great faculty here at the School of Nursing, and I wanted to talk about some of the areas of research that they focus on. so, and much of our research focuses on our foci of the program. So we have faculty who do research with older adults living with mental illness and dementia. A lot of work around promoting health of older adults within our community. Rural is another foci for us. So some faculty are doing research around substance use in rural settings or food insecurity. We also do a lot of research around homelessness and primary healthcare, research in primary healthcare with transitions to practice or scope of practice. Interprofessional care is a big focus, gaming and simulation, and some art-based pedagogy as well. And then maybe I'll just speak a little bit just about my own research. I'm a global health researcher and tend to focus on access to medicines and universal health care. So I'm currently just working on a 3-country study where I'll be looking at guidelines for rare disease programs in developing countries. And it's to be a 3-country study in Ghana, 2 regions of India and Brazil.
Wow. That's amazing. So you are also a facilitator at the school, right? Like you teach courses as well?
I do. Right now, I'm the collaborative program coordinator. So my other part of my workload, I clinically instruct the students who do their placements in Guatemala or Honduras. So in second year, we have many great placements, but one of the placements is an international opportunity in second year when they're doing their community health placement. And right now, we're doing placements in Honduras and Guatemala.
Yeah, that's fascinating. You said the word placement, and we've talked a little bit about placements, but when we're speaking with international students in different ranges of programs, we always have to make the distinction between co-op, internship, placements, experiential education. Could you tell us what a placement is at its very base level and how much placement they will have the opportunity to take?
Yeah, so we have a wide variety of experiential learning. So when we talk about placements, it's them doing some clinical practice hours within our organizations, local organizations. So we have over 1,000 hours of clinical placement time. And Kathleen talked about that when she was going through her presentation. So we would offer placements in hospitals, in homeless or youth shelters, schools, public health agencies, in rural and remote communities. And so they could be in hospitals or community-based organizations. And then we also, as I was saying, we have the international placement options.
Yeah, awesome. Great, thank you. So this one's a little bit more unique, but sometimes we get asked on the road, and I have a tough time answering this question specific to nursing, but it's about specializations. So, I'm always curious about how specializations within the program work, if they exist, or if that's something that nurses achieve after they graduate the program and enter into the workforce.
That's a very good question. And our program is a general program. So there are no specializations. Those are things that happen after. But the important part to consider is they get an experience with specific faculty. And those faculty have areas of expertise, just like Dr. Tracy was explaining that there's different foci of research or emphasis. And our students will get a little more exposure or get more interaction with people that are at the forefront for aging or rural health. And so that provides a different type of experience that you might get at other institutions. So it is a general degree. It prepares our students for any type of nursing, right? They're ready to enter the field in any area of nursing, but they will get more exposure to individuals that have expertise within the areas of foci. Again, rural health, indigenous communities, gender issues, women health, as well as aging, and what's the last one? I'm forgetting.
Mental health.
Mental health. Thank you.
So that's amazing. Thank you. One of the final questions that I had was about emerging technologies. And what I mean by that is we again speak with students often who ask, or, we kind of guide them into this because the students that we speak to internationally, sometimes they'll be in their 20s or 30s or 40s, but typically the students that we speak to are in their teens, 17, 18, 19, and the workforce that they'll be entering into and the nursing fields that they'll be entering into are sometimes dramatically different than what the students are currently entering into when they graduate. And so I was wondering how, our nursing program stacks up and how we keep on top of emerging technologies within the field. And this is tough for me because I'm not really familiar with how the nursing field develops, but how does Trent prepare students for the workforce that they will be entering, in specifically in terms of, the courses that we offer, or do we update them, stuff like that?
That's another very excellent, great question. And it's important to always stay at the forefront, right? Being current. And the Trent Fleming School of Nursing has a great curriculum, and it's always constantly trying to improve its curriculum and update it. And we're currently in the midst of doing some major revisions. What we're doing is actually establishing a curriculum that meets the needs of our partners in the communities, whether it's hospitals, whether it's schools. What do they need? What do they need in terms of the nurses, and what qualifications do they need? So we backtrack and try to make sure that it meets those the specifics. Our school or our courses or our curriculum is scaffolded. There's three components to it. There's the theory courses, as I was explained before. There's laboratories, and there's clinical placement, where the students go into the practice, into the clinical environment. When it comes to laboratories, we're really proud when the Trent Fleming School of Nursing that we have a fully accredited simulation and laboratory area. This is the only place in Canada at the university level to have that. It compares to other places like Penn State, Yale, and UCLA. So this means that our laboratories and our simulation environment is actually accredited by the Society for Simulation in Healthcare. It means that we meet certain standards for practicing and delivering and teaching skills and educating nurses to be in terms of best practice when interacting with patients and delivering care.
Wow.
So it's a nice feature, not everywhere. Yeah.
That's really cool. I wasn't aware of that actually, but that's great. We'll be sure to tell more students about that when we're speaking about the nursing program. But the final question I have, and it's an easy one, but I will ask for an expansion on it, but student faculty ratio. So student faculty ratio for those future applicants who are interested, it's how many students per faculty in a particular program. And so there's one for the institution, and then it varies between the different schools within Trent. So does anybody know what the faculty to student ratio is? And then on top of that, what's a typical class size for a student in first year versus fourth year, or your final year, I should say?
Yeah, I can take that one. So I believe on paper for nursing, it's 20-1 is the student faculty ratio. In terms of how that looks in the actual program, in first year, like many first year courses, students do larger lectures and then kind of the smaller seminars. So that's something that's really great about Trent is, so the largest lecture hall on campus holds 380 students. So that's as big as it can get. Our program with our intake of both collaborative and compressed, we sit around kind of 240. So that's sort of the biggest lecture that you can expect. And then from there, you would have like a workshop or a seminar for a theory course that's capped at 26. So kind of between 20 and 26 for those seminar groups, which is that opportunity to have discussion, to consolidate that learning that you might have gotten in the lecture and connect with either a teaching assistant or your faculty. Within nursing, as we mentioned a bit, there's a really big hands-on component. And in order to be successful in those environments, it is really important to have that one-on-one time with your instructors. So in the simulation labs that Hugo was just talking about, the maximum we have in a lab is 8 students. So that's the most you're going to get. Students usually work either independently or in pairs. And again, a lot of that is like hands-on practice. So watching something be done, practicing it together, and then eventually being assessed on those skills. So much smaller there. And then again, in practice, in the clinicals, the largest clinical group that we have is 8 students. So you're there in a small group, you're there together to support each other, and you get a lot of that one-on-one time with your instructors in the actual clinical environment. We do have 2020, the community-based practice, where in the seminars, they're 20 students, but the projects they're working on are in groups of 2, sometimes 3. So again, really, really, like, you get a lot of time with your faculty and instructors. And when you're in the 4th year of the program, that's where you're paired one-on-one with an RN. So there you have individualized attention as you're getting ready for the profession and to enter the profession. So you're supported in that environment. You would still have a faculty that oversees that. So you still have the connection with the university and a faculty to support the learning. And you get a lot of support and time to kind of build those skills and gain that confidence to be able to start taking on patients by your final semester. So yeah, we have a lot of that opportunity for smaller group work. Certainly a lot of support in the department, and it's something that I remember when I was a student, I wasn't too concerned with. I wasn't really thinking about why that matters, but in practice at Trent, it really does matter, because you're not just getting like an overview of a subject, you're getting the opportunity to ask questions, to have some of that individualized attention. Certainly later on, if you're applying to, say, a graduate program, you have faculty who know who you are. They can loan you resources or advise or support whatever area you're looking into. So it allows you to build really great relationships that I think for many students can make a program stand out.
Yeah, that's great. Thanks for that. It's true. A lot of students don't necessarily consciously think about class sizes too much when they're making the selection. But as you work your way through the program and experience different academic challenges, that's the thing that really does make the difference between institutions, between courses too. But that's it for my formal questions. There's a full dedicated question and answer webinar happening right now in a separate thread. So I want to encourage anybody who has more questions about the program to head over to that thread. There's also a live stream for our campus tours available too. So for students who want a campus tour of the facility. And then immediately following this, part of the webinar will also be providing a tour of some of the nursing simulation labs with our wonderful host, Bryn. So I want to thank Hugo, Kathleen, and Patty for being here and providing us with a really great overview of the School of Nursing at Trent University. So thank you so much, and we'll talk to you soon.
Thank you.
Thanks, everyone.